this important press briefing. Of course, the Ministry of Health, Wellness and Social Services thinks it's vital to keep the general public, the people we serve, abreast with what's going on within the ministry. And this morning we're speaking to a profession that is at the core of any healthcare system, nursing. You know, everybody has a story about my nurse. We claim our nurses. So this press briefing is strictly about the nursing profession in Dominica. Let me recognize this morning the Minister of Health, Wellness and Social Services, Honorable Cassandra Laville. We recognize as well the Permanent Secretary acting in the Ministry of Health, Wellness and Social Services, Dr. Laura Esprit. Principal Nursing Officer within the Ministry of Health, Wellness and Social Services, Terelia Ravalier. The Senior Administrative Officer in the Ministry as well, Fernando Raymond. Matron at the Dominica China Friendship Hospital, Emily Matthew. We have with us Department Nurse acting at the Dominica China Friendship Hospital, Sister Sandra Daniel. Other staff of the hospital, Community Health Nurse, Shannon Seraphin. Other staff of the Ministry of Health, Wellness and Social Services. Media partners, the viewing and listening public, again, good morning.
Good morning.
We start off this morning by introducing the Principal Nursing Officer to do a presentation, Terelia Ravalier.
Good morning, everyone.
Good morning.
Nursing attrition, nursing shortage in Dominica. For years, the world has been grappling with the shortage of nurses. However, the COVID-19 pandemic has worsened the crisis of emergency shortages. Recent estimates indicate that Latin America and the Caribbean have approximately 44.3 nursing professionals per 10,000 people. This is insufficient, as it falls short of the 70.6 per 10,000 needed to achieve the United Nations goal of universal healthcare and coverage by 2023. Recent research on nurse migration in the Caribbean revealed that 40% of nursing positions in the region still need to be fulfilled, largely due to nurses leaving for other countries. Caribbean nurses frequently migrate to developed nations such as Canada, the United States, and the United Kingdom, which is a major concern for the Caribbean government. It is worth noting that there is also movement of nurses among Caribbean nations. While nurse migration helps address shortages in destination countries, it worsens the deficit of healthcare workers, leading to a brain drain and economic challenges in the Caribbean. Researchers have looked into the motivational factors behind nurse migration, also known as the push-pull variables. They found that nurses usually move for reasons related to professional development, financial benefits, and educational advancement. The pull factors include improved working conditions and better opportunities, while the push factors include low salary, lack of career growth, and challenging working conditions. The provision of care by staff is crucial for the functioning of a healthcare organization. It is worth mentioning that nursing is the most noticeable professional human resource group in almost every nation and is highly esteemed as the primary caregivers and essential support of healthcare systems, constituting over 50% of all health professionals. Essentially, this means that the degree of confidence and productivity in nursing services has a significant impact on healthcare outcomes. The significance of nurses in healthcare is immeasurable. Nurses improve patient care through dedicated time, performing duties, using their skills, assuming multiple roles, upholding ethical principles, and committing to continuous learning to provide up-to-date nursing care. The nursing service in Dominica operates within the context of the primary and secondary healthcare system, providing services at the Dominica China Friendship Hospital and within the 7 health districts, to include the Dominica Infirmary, the Dominica State Prison, and the Grotto Home for the Homeless. In Dominica, nurses make up approximately 52% of the healthcare workforce and are registered and licensed to practice with the Nurse Registration Ordinance. The Ministry of Health, Wellness and Social Services over the years have been confronted with the problem of nurse attrition, nurse shortage, like every other Caribbean country and the world by extension. And this can be considered an acute or an already chronic situation. This has had a disadvantageous effect on the quality of nursing care at health facilities on the island. The data presented indicates that the main reason for nurse shortage is mainly due to migration. According to our statistics, between 2013 and 2024, 125 nurses have resigned and 33 retired from the service. Based on information from the Government of Dominica Establishment and Personnel Unit, the nominal role for the nursing personnel for the Ministry of Health is 420 established positions for both the Dominica China Friendship Hospital and the primary health care. However, 139 from the primary healthcare system plus 165 from the Dominica China Friendship Hospital leaves us with 340 positions are currently filled, with 85 personnel at the primary healthcare system plus 31 personnel at the Dominica China Friendship Hospital, which leads us to 116 vacant personnel. It is important to note here that through the government diplomatic relationship with Cuba, the nursing service has been benefiting from the services of mixed skills nurses from Cuba. Currently, there are 11 nurses engaged at Dominica China Friendship on-call allowance and call-out allowances for nurse practitioners. Increasing session rates at the Dominica China Friendship Hospital, the RFA Hospital, and Marigot Hospital. Approving duty-free concessions on the purchase of vehicles by all nurses. Providing permanent appointment when due to nurses as a means of secured tenure. Increasing the pool of nurses. Ministry of Health has sought to employ available nurses, competent retired nurses, as well as nurses who left the service and showed great interest in returning. Consistently, the ministry have increased in the input versus the output of nurses, bearing in mind that the Ministry of Health has been addressing a chronic shortage issue. Training and engagement of approximately 34 community health aides to support the nursing service, and improvement in working conditions, newly built structures. Recently, there has been remuneration benefits, increase in salaries of nurses as a result of the organizational review and reclassification within the public service. The nurse shortage in Dominica has become a pressing problem that the Ministry of Health, Wellness and Social Services and the government are currently discussing. There are strategies in place, and we are taking short, medium, and long-term actions to address these challenges. We recognize the importance of continuously improving the quality, quantity, and skills of nursing staff. It is essential to offer attractive incentives to ensure staff retention and maintain high-quality healthcare in the Ministry of Health, Wellness, and Social Services. We are currently working with the government on a leadership initiative aimed at bringing about change and reviewing and modernizing the nursing framework to allow for the ability to maintain a productive workflow, opportunities for career advancement and job movement within the nursing service, chances to improve and strengthen supervisory functions, improving public perception of the nursing profession, and increasing effectiveness and enhancing our service delivery. Provision of adequate incentives for the retention of nurses is another area that is being looked into. We as the ministry are prepared to embrace continuous investment in education, training, and workforce development within the nursing service, resulting in cost savings and enhanced health outcomes for the citizens. We are considering empowerment of nurses to shape healthcare policies and improvement initiatives for the nursing service. As we have developed a training needs plan to secure greater investment in nursing education and professional development to develop nurses with the advanced knowledge and skills needed to promote health and well-being. We are further requesting that consideration be granted to nurses by the authority to influence and develop appropriate healthcare policies to guide our efforts to enhance the service and improve overall service delivery in Dominica to our citizens. As the principal nursing officer and head of the nursing service, I give you my assurance that I will work assiduously to address the issue of nursing shortage and advocate for changes in the nursing profession. We must increase the number of nurses and improve the overall quality of nursing in order to achieve our objectives of providing optimum nursing care services to you, the people of Dominica. We ask for the support of the public, their cooperation and commitment to work with us to help maintain and improve the quality of care despite the shortage of nursing staff. To the nurses, approximately 21, who have recently been successful in the regional examination for nurse registration, the nursing assistants who were also successful at the local General Nursing Council examinations, and others who are unemployed and qualified to work as a nurse, nationals as well as non-nationals. We are in urgent need of your engagement. We are therefore requesting your prompt application to the nursing service through the Ministry of Health, Wellness, and Social Services. Before I end, I extend thanks to the Honorable Prime Minister, the Minister of Health and Social Services, the Minister of State, the Parliamentary Secretary, the Permanent Secretary, other health officials, nursing education institutions, All Saints University School of Medicine, and the Dominica State College Faculty of Health Sciences, who have been great supporters and collaborators to the nursing service. I also thank the General Nursing Council for ensuring that registration and licensure of nurses are done swiftly, and to the Nursing Association and all other healthcare providers who have consistently lent remarkable support to the nursing service. To all the nurses, including our Cuban collaborators and other non-nationals, please accept my commendations and gratitude for your vital role and unwavering support to the healthcare sector here in Dominica. In conclusion, it is critical that we, as a nation work together to tackle the nursing shortage to bridge the gap in Dominica. A well-educated, skilled, and evenly distributed nursing workforce is essential for establishing a strong healthcare system, addressing the health needs of the population, and effectively preparing for future challenges such as disaster and pandemics. I thank you.
Thank you very much to our PNO, Terelia Ravele. Now, PNO, we'd like to commend you for your leadership of the nursing service in Dominica, for the hard work that you have been putting in as well. Thank you so much. And to speak on the nursing profession within the hospital setting, the secondary care setting, we welcome Department Nurse Acting, Sister Sandra Daniel.
Thank you. Good morning to all. Nursing at the Dominica China Friendship Hospital, we know as DCFH. So you're a new nurse and you don't know what to expect, what you should know. Nursing at DCFH over the years has expanded greatly, providing care in several areas such as emergency nursing, intensive care, mental health, general inpatient care, outpatient care, and surgical management. Here at the DCFH, we are guided by the aims of nursing. Our aims of nursing are to promote health, to provide care, to prevent illness, and alleviate suffering. I work in collaboration with a great team of professionals: ward doctors, specialists, physiotherapists, dietitians, X-ray technicians, orderly department, medical lab technicians, and other team players to ensure effectiveness of the aims of nursing. So the aims of nursing, we work together to ensure that it's done. At DCFH, we the nurses are rotated to different clinical areas to gain experience and ideally to become an all-rounder, quote unquote, meaning being able to efficiently function wherever you are assigned to work. The different areas we work: the medical wards, which is Glover and Emery, surgical wards, Daubigny and Alford, pediatric and neonatology wards, operating theater and our new eye care center, maternity ward, psychiatric unit, outpatient and dialysis department, oncology unit, accident and emergency department. The male medical ward and the female medical ward, presently we function as one unit. These areas, persons come in with, we treat persons who come with stroke, diabetes, high blood pressure, uncontrolled high blood pressure, uncontrolled diabetes, heart problem, pneumonias, and several other non-surgical conditions. On the surgical wards, which are Alford and Daubigny, we treat persons who have accidents, yes, but also this is not where it stops. We have other persons who come in with eye problems and other areas, especially for Alford, accident, eye problems, surgery. But for Daubigny, we have also gynae problems that are treated and managed there with the nurses give care. We also have ear, nose, and throat problems as well. The pediatric ward, the children we treat are children from 1 month to 17 years old. After 13, they become adolescent, we treat them. The neonatal unit, we treat newborns from birth to 28 days. Operating theater, as we know, that's where surgeries are done. Maternity ward, which we call Stronach, delivery of babies. Psychiatric unit, people with mental conditions that they cannot take care of themselves at home or cannot treat in the community are admitted there. where they're taken care of. In the outpatient clinics, we have a variety of areas that we take care of, and we, the nurses, are assigned to these areas. We have the dialysis unit, and it's a unit by itself. In the dialysis unit, you don't have to go overseas. You're a new nurse, you're interested in dialysis unit because you probably see it on TV, or you probably watch programs with it. You go through a training on the job. Patients who need checkup, they go to the medical outpatient clinic, and we have nurses assigned there who do the clinics. So if you as a new nurse, you don't want to work on the wards, you can also request to work in outpatient, where you are assigned to a clinic, or where you are assigned to either dialysis or oncology, or somewhere where you can receive on-the-job training to function in the areas of your choice. Oncology, as we know, it might be a big word, but to those who are listening, it's basically persons with cancer who come to that clinic to get their checkups and to get their treatment, chemotherapy. At accident and emergency department, the nurses are not just rotated there. They get on-the-job training as well, where they learn to do ECG. So we know there's an ECG area, but as we know, it's nurses who man it. So if you're interested in ECG, you can also request to go to the ECG department, where you'll get on-the-job training. And basically, most of our nurses are presently trained and are able to work in that department comfortably. Our work schedule at the DCFH, we work 8 hours and 12-hour shifts. 12-hour shifts encompass the night, also the day shift. Now the day 12-hour shifts, a lot of nurses presently, we are doing it. Why? Because it is comfortable for us. 1 week you work 3 days, 12 hours, and the other week you work 4 days. So you get more time for your family, more time, more alone time, more time for yourself. And but there are some nurses who doesn't really like it, so they work 8 to 3, 1 to 8 shift. I work 12 hours, and to me it's comfortable because I love the days off. Okay, the 12-hour day shift are also by choice. It's not forced upon you. You choose to. We have nurses who do 8 to 3, 1 to 8, and they come and they say, "Sister, I would prefer to do the 12 hours now because I want more time." So you get more time. If they don't want to continue, they come, we also change it. So it's flexible. And as nurses, we are fully equipped with the skills we need to help us provide optimum care to the patients on a day-to-day basis, which includes medical knowledge of patients' condition. You are strengthened in the medical knowledge of patients' condition. You don't just come and like we are told, you do blood pressure, the medication. No, there are new conditions. You get to know. We have the doctors who do on the wrong teachings, and this is very beneficial for us. And I have learned a lot from that. I have one of my doctors there who was very big on doing teachings, Dr. Sentile, if I may call your name. He would check his patients and do teachings. I learned a lot under him. And so as a new nurse, you're able to learn a lot under the doctors doing these teachings. Interpersonal skills to strengthen your interactions with the patients. And you learn interpersonal skills. We have teachings that we have sessions, we have workshops, we have in-service sessions that are being done when we identify a shortage, like a group of nurses, okay, they need some strengthening there. We have the in-service team who get these teachings done, these sessions done, so that we can attend these sessions and really strengthen ourselves. And for the years, I've been there a long while, and for the years, I have had that opportunity to really upgrade myself through workshops and in service. So as a new nurse, I would encourage you to really come into the system. Don't come with fear. You might come with a little fear, but you will be helped, and you will receive enough to make you a better nurse. Problem-solving knowledge and skills. We also have workshops. We do on the job. We have nurses who one of our objectives of our EADR, which is our appraisals, is that you do teachings as a staff teachings. So we have nurses who go online, get information, and we do teachings on the ward to help each other. So don't be afraid. Okay, so we also have collaboration skills where we are able to work with other professionals. We're able to call a dietitian, we're able to call liaise with the physiotherapists. And you know, the physiotherapist, I like the department because she comes and while she's doing physio, you as the nurse involved, she says, Sister Danielle, come, let me show you. She'll call the nurses and we work with her to learn how to, when she's not there, what to do for our patients. Okay, so also there's advancement and prospect in the nursing career. You don't just stay there as an RN or stay there as a nursing assistant. So you come in as a nursing assistant. Thank you. However, you can go further. We have had nurses who came in as a nursing assistant and went further. If I may use myself as an example, I came in as a nursing assistant, but with God's help and with encouragement, even my matron, I would mention her, she's encouraged me, Danielle, don't just stay there, go further. So I've gone further. And I want to encourage you, even if you come in as a nursing assistant, doesn't mean you have to stay there, you can go further. You can also become a member of our professional nursing organization, which is we refer to as the Dominican Nurses Association, where you can connect with other nurses. Online, we have an active chat online. Also in the district, you know other nurses, you connect with them, and even in the diaspora. Earning certification. There are several online courses available presently, and also there's courses available at UE. For example, the leadership course. There's a leadership course. Many nurses have done it. Even some of us at the departmental unit departmental area has done it. And I encourage you to take advantage of it because it's a great leadership course. And also customer care. There's a customer care course that can be done at UE to advance yourself. You don't just stay, you come in so, you don't leave so. There are prospects for career mobility. I appeal also to the males out there. Nursing is not just for females. We have majorities females, but the males, we have some males and we applaud them and kudos to our male nurses. But we also like more male nurses to enter the nursing service. Trust me, it's a very good service. I can comfortably say that because it made me a better person. And I love nursing. So I appeal to you, those who are at college, All Saints. Enter nursing. If you're looking for a good career, enter nursing. It's not just for females. It's a good career. Just as the engineer is not just for engineer career, is not just for males. There are females doing engineer. So nursing is not just for females. Males, you can do it. So just to end, some of the on-the-job training you can get while you are a nurse in each area. Workshops, I mentioned that. We have the CPR training and basic life support, which we are required right now. Every 2 years, we renew it. And these are good trainings. Even at home, you get it. If somebody, family member of yours is going to distress you, right away you're able to do it because you have that training. Dialysis unit, the dialysis nurses also is on the job training, on the job. I was a dialysis nurse for 8 years. ICU on the job training. So nurses, please apply, as PNO said, apply to do nursing. It's a very good career, and in Dominica, it is good. We need you. Also theater. Presently on-the-job training. Oncology, you get on-the-job training to do it. And as I said before, ECG, many of us learn ECG. Gastroscopy also is another area where you get on-the-job training. And all these areas that I've mentioned, nurses work in those areas. Thank you. Blessings.
Thank you so much, Sister Daniel. I'm sure we all heard that passion in Sister Daniel. She mentioned that she's been doing this for years, but thankfully her passion hasn't waned in all of those years that she's been working as a nurse. So thank you so much, Sister Daniel. Now, quite the opposite, our next presenter hasn't been in the service as long as Sister Daniel, but I believe that so far she has been a very impactful nurse in the community that she served. So we welcome our final presenter, community health nurse, Shannon Seraphin.
Good morning. My experience as a primary health care nurse. My name is Shannon Makima Seraphin, a community health nurse in the Roseau Health District. I have been a nurse for the past 14 years, and it has been an incredibly rewarding journey. For me, nursing is not just a career, but my passion and a fundamental part of my identity. As a registered nurse and midwife, I have had the privilege to impact lives from before birth through all stages of life, including supporting individuals to a peaceful and dignified death. My goal has always been to positively influence everyone entrusted to my care and to serve others with the love and attention that I think I deserve for myself, so that each person leaves me better than when they entered into my care. It is immensely gratifying when someone I have cared for or their loved ones express their gratitude with a simple, "Thank you, nurse, I appreciate you." For us, the nurses who work hard despite the adversities, who give our all and do our best for the people that we serve, this is one of our greatest rewards. Throughout my career, I have experienced significant personal growth. My passion led me to work as a district nurse within the primary healthcare system, opening doors to opportunities beyond my initial dreams. I have been involved in all facets of nursing care: prevention, promotion, restoration, rehabilitation, and supportive care, caring for clients at every stage of life. From my start as a registered nurse on Winston Ward, to becoming a district nurse in the Casablanca Health District, then advancing to a midwife, and now a community health nurse, this journey of growth required continuous self-motivation, skill enhancement, and academic achievement. I seized available opportunities and learned from mentors who helped me address weaknesses and unveiled strengths that I did not even know I possessed. Through these experiences, I have also cultivated an attitude of humility and gratitude, which has further shaped my nursing journey to this day. Throughout my career, I have learned the importance of working as part of a team, particularly in the face of adversity. During one of the most challenging times of my career, the COVID-19 pandemic, I was thrust into the management role at the Casablanca Health District. Imagine being a manager for the first time during a crisis, charged with the responsibility of leading a team through a period of uncertainty, exhaustion, and relentless pressure. Against all odds, our team's resilience and dedication earned us recognition as the most consistent health district during that period. For me, this experience reinforced the power of teamwork and the importance of leaning on others for support. I never felt alone and was able to rely on the guidance of my supervisor and the support of my team to achieve such a feat. Nurses, you are such a vital part of the team. Joining the nursing profession means not only acquiring new skills, but also becoming advocates for the welfare of others. Your voice matters greatly in the healthcare landscape. And as you progress in your career, you will witness the profound impact that you can have on the lives you touch. Nursing extends far beyond the clinical setting. It positions you as a champion for the rights and health of those you serve, especially within your own community and country. What better place to be a champion than in your own country? Who better to be an advocate for than your own people, your families, your friends, your neighbors than you? For me, making a difference in Dominica is both a privilege and a choice. I choose to serve and make a positive impact in my country, and I know you can do so. Despite the myriad of challenges and numerous adversities that we face in the nursing field, it remains a profession I would choose over and over again. To aspiring nurses, I encourage you to consider this noble profession. For those already in the field, seize the abundant opportunities available. Look beyond the challenges and recognize the countless lives you positively influence daily. Your efforts do not go unnoticed. You bring comfort, smiles, and courage to many. Let us, nurses, continue to shine as beacons of hope and be agents of positive change for a healthier, happier Dominica. Thank you.
Thank you so much, CHN Seraphine. Remember at the beginning I said how impactful she is? Yeah, if you were not moved by what she just said, I'm not sure anything else can move you. So thank you so much. We'd like to thank, of course, all of you for joining us today, the listening and viewing public once again, for being with us this morning. We ask that when you see a nurse, bless a nurse. Because the nurses have blessed our lives in so many ways. Sometimes, I know Seraphine said the simple thank you is enough. Yeah, but it's a profession that sometimes it's not, it's a thankless profession sometimes. It's a tireless profession. You know, so much effort, so much hard work goes into that. They are the foot soldiers, the heartbeat of the health system. Bless a nurse when you see a nurse. All right, thank you everybody once again, and we wish you all a blessed day. Thank you.